I thank Dr. Jyotidev and his team for giving me a chance to be here in your midst. Now, let's come to the topic. Diabetics are prone for infections because of hyperglycemia and poor diabetic control. So, apart from microvascular and macrovascular events, infections are also to be regarded as an important area. Now, how to bring about a change? Here is the relevance of vaccine strategy. We have vaccines, pneumococcal, influenza, hepatitis B, and this is a relatively new area. Some of the physicians prefer to give injections to all the diabetic subjects under the age 60 years. Some do not share this view. So, to throw more light on this, Dr. Anuj Maheshwari is here. He is the professor and head of internal medicine, Babu Banarsi Das University, Lucknow. With your permission, I am inviting Dr. Anuj Maheshwari.
First of all, congratulations to Dr. Jyotidev for organizing a wonderful congress with very good topics. And thank you, chairpersons, for inviting me and very nice introduction, kind words of the introduction. But this is my duty to invite you all for a mega event what we are going to hold at Lucknow. RSSTI 2015 annual congress is being held at Lucknow. So kindly block your dates and be ready to be a part of this mega event. It is going to be a really different this time. Now come over to the topic. In next 20 minutes we shall be discussing over a much ignored part of the diabetes management, which is recommended vaccination in diabetes, pneumococcal and beyond. Why do we really need vaccination in diabetic individuals? It is really a big question, and many times many people are not really convinced with the need of the vaccination in the diabetic individuals. Diabetic patients has got some aberrations in their host defense mechanism. Diabetes itself is an independent risk factor for developing infections due to alterations of host defenses because of poor antibody response, cell-mediated abnormalities for the reasons of reduced CD4 counts, and CD4-CD8 ratio is reduced, changes in natural killer functions, reduced lymphocyte blastogenesis, defects in the interleukin-2 functions, and reduced phagocytic functions of the monocytes. Apart from that, there is the impaired leukocyte function, which has been proved in number of studies, and patient becomes predisposed to get colonization of the bacteria, and ultimately it develops pneumonia too because of the pneumococcal infection. There has been a study. May I have pointer, please? May I have pointer? There has been a study about the impaired leukocyte functions in diabetic individuals, in which it has been evaluated polymorphonuclear cells function in diabetic individuals for their expression of the adherence molecules, chemotaxis, phagocytosis, and bactericidal activity. And ultimately it has been found that polymorphonuclear chemotaxis has been found to be significantly lower in patients than in healthy individuals. And it has been found to be associated with spontaneous adherence and increased expression of the adhesion molecules. At the same time, it has been seen that increased response to chemiluminescence reflects spontaneous activation of the polymorph cells and increased free radical protection after stimulation. Response was lower than the healthy controls. Type of diabetes, age of the patients, HbA1c level, disease duration really did not affect the response. Chemotaxis and chemiluminescence were further reduced in patients with vascular complications and hyperglycemia. So ultimately, the study has concluded that all steps of the polymorph nuclear cells functioning are altered in diabetic individuals, whether they are controlled or uncontrolled, and this may increase the risk of the vascular complications and infectious episodes. Pneumonia and diabetes, there are certain facts which you all must know. That diabetes mellitus is often associated with age, cardiovascular, renal function, renal dysfunction, and increasing the risk for severe pneumococcal illness. Diabetes are more liable to develop complications like bacteremia, delayed resolution, recurrent pneumonia, what we all know very well. But apart from this, we know that diabetics are more likely to be sicker longer and go to hospital or even die more frequently. 3 times more likely to die with flu and pneumonia-like diseases, which are easily managed in non-diabetic individuals. Diabetes is a risk factor for bacteremia in patients with pneumococcal pneumonia. It has been seen when it has been compared with age-specific incidence of pneumococcal disease in healthy individuals with the people, those who were carrying the chronic illnesses like chronic heart disease, diabetes, alcohol, and chronic lung disease. And it has been found that adults, those who were carrying diabetes, chronic heart disease, or chronic lung disease had a 3 to 6-fold increased risk of invasive pneumococcal disease. So IPD, invasive pneumococcal disease, is one of the major clinical syndrome of pneumococcal disease. According to CDC, approximately 5 lakhs cases of pneumococcal pneumonia are estimated to occur annually in the US, resulting in approximately 1,75,000 hospitalization. The case fatality rate is approximately 5% to 7% and may be much higher in the elderly. And you will see in the forthcoming slides about the Indian data of the case fatality ratio, then you will be surprised to know that in India it is 26.4. Pneumococci are responsible for up to 36% of cases of community-acquired pneumonia and up to 50% of cases hospital-acquired pneumonia in adults. Primary cause of the vaccine preventable deaths in all age groups worldwide has been compared, and it has been found that pneumococci is having the largest share in all age groups, followed by the measles and then hepatitis. So pneumococci is a bacteria which can very well be avoided by using the vaccine, and it is a vaccine preventable death. Invasive pneumococcal disease, which has been associated with high case fatality in India, what I was discussing in one of the previous slides, there has been a study in which the serotype and group has and antimicrobial resistance pattern of the invasive pneumococcal disease has been assessed in India, and it has been also assessed the potential coverage which could be offered by the polysaccharide pneumococcal vaccine 23 in older subjects who are admitted to hospitals. 15 years prospective study which has been done in major colleges of the India, including the AIIMS, KGMC Lucknow, Government Medical College Nagpur, Christian Medical College Vellore, and Medical College Trivandrum, and Lokmanya Tilak Medical College Mumbai. And ultimately it has been found that case fatality ratio was 26.4% by invasive pneumococcal disease, and it has been found to be in all age groups. Less than 50, again it was 25.2, between 50 to 60 it was the highest, 30.2, more than 60 it was 26.1. Preponderance of the male in getting more case fatality, and it has also been seen that pneumococcal disease was more prominent in 36.9% with the meningitis, 20.8% the pneumonia, presenting with 36.6% in the form of the septicemia, 5% in peritonitis, 40% in deep pus, and 15.5% in other kinds of the infection, and total case fatality was 26.4%. It has been also seen with this study that 43.3% patients of the total inclusions have, out of which 40% were found culture positive, and remaining patients have been found to be suffering with influenza, other pathogens, and a large percentage, 55% was, which no pathogen could be isolated in the culture. So out of the isolated organism from the invasive pneumococcal disease, 90% patients, 91% pathogens were streptococcal pneumoniae. So again, it has been found, when it has been evaluated the efficacy of the polysaccharide pneumococcal vaccine 23, it was found that serotype groups included in the polysaccharide pneumococcal vaccine 23 contains 82.3% serotypes of streptococci pneumonia. In patients aged older than 60 years, PPV23 contains serotype groups that were involved in 83.3%. The potential protection have been measured by cumulative coverage of invasive serotypes by this polysaccharide pneumococcal vaccine 23 in the patient aged younger than 50 years was 80.8. So in all age groups it was found to be equally effective. When this particular vaccine has been, when assessed in the immunocompetent host, it was found to be 84%. It was found to be 84% effective in the diabetic individuals. So this was a good ratio in which this has been seen that pneumococcal vaccine was found to be efficacious against the pneumococcal infections in 84% of the diabetic individuals. Although it has been found to be effective in other diseases also, but highest percentage was in the diabetic individuals. Evidence-based efficacy of this polysaccharide pneumococcal vaccine and its effectiveness has been assessed by the meta-analysis from Cochrane collaboration, and it was found that almost 74% efficacy in all invasive pneumococcal disease, and all-cause pneumonia was found to be having 28% efficacy. So conclusion has been derived that meta-analysis has provided the evidence supporting the recommendation of polysaccharide pneumococcal vaccine to prevent invasive pneumococcal disease in adult individuals, may they be suffering with diabetes or not. When it has been assessed in the efficacy of the 23-valent pneumococcal vaccine in preventing pneumonia and improving survival in nursing home residents, it has also been found to be having the good results in the hospitalized patients too. So ultimately, the rationale for using of the pneumococcal vaccination has been found that pneumococcal polysaccharide vaccine includes 23 purified capsular polysaccharide antigens representing 85 to 90% of the serotypes of streptococci pneumonia. Diabetic patients have a normal humoral response to pneumococcal vaccination, so they can be very well be used. Pneumococcal immunization in diabetic individuals significantly reduces morbidity and mortality related to pneumococcal disease. Vaccination is a cost-effective preventive strategy. ADA recommendations in 2015 says that we should provide routine vaccination for children and adults with diabetes as for the general population. It also recommends to provide the influenza vaccine annually to all patients with diabetes more than 6 months or 6 months of age. Administer pneumococcal polysaccharide vaccine 23 to all patients with diabetes 2 or more than 2 years. Adults 65 or more of age, if not previously vaccinated, should receive pneumococcal conjugate vaccine followed by pneumococcal polysaccharide vaccine 23 6 to 12 months after initial vaccination. This pneumococcal conjugate vaccine is a pediatric vaccination for against the pneumococcus. So this is having the conjugate base of the pneumococcal bacteria. Adults 65 or more than 65 years of age, if previously vaccinated with polysaccharide vaccination of pneumococcus, should receive a follow-up of 12 months or after with conjugate vaccine, which is the pediatric variant of the pneumococcal vaccine. Now what does the API says? API has also released its recommendations about the immunization in 2014. And it says that immunocompetent person should be vaccinated if they are having underlying medical conditions like chronic heart disease, chronic lung disease and diabetes. In all these group of the patients, they recommended that polysaccharide pneumococcal vaccination should be given. Here you can see that. Now it has also been recommended to give the influenza vaccine. Influenza, which is a common flu, and number of diabetic individuals dies of this flu also. It infects the respiratory system. Complications include pneumonia, fever, croup and bronchitis. People with asthma, chronic diseases of the lungs, heart or kidney are at greater risk. Most deaths from flu occur in people 65 or older. So ADA has recommended that annually we should provide an influenza vaccine to all patients with diabetes, those who are 6 months or older of this age, to avoid the infection of the Haemophilus influenzae. Hepatitis B vaccine, we all know about this, and we usually try to give this vaccine even the professionally exposed people for the hepatitis B. This is a virus that infects the liver, is spread by sexual contact, blood, saliva or other body fluids. About 1 lakh people catch hepatitis B every year in the United States. High risk population, most of the time at the risk, and first vaccine is there to prevent the cancer, because the people, those who are getting infected with hepatitis B, they are more liable to get the liver cancer. So hepatitis B vaccination has been recommended by the ADA to administer hepatitis B vaccination to all unvaccinated adults with diabetes who are aged 19 to 59 years. Consider administration of hepatitis B vaccination to unvaccinated adults with diabetes who are aged more than 60 years. So adult immunization scheduled as per the age has been recommended by the authorities in the United States, which has also been accepted in India by the API also, that all the influenza vaccine should be given 1 dose annually to everyone in all the age groups. As far as the pneumococcal vaccine is concerned, they have recommended this should be given every person who is above the 65 years. And before that, the high risk individuals should be given the pneumococcal vaccine. And similarly, the hepatitis B vaccination 3 doses should be given to everyone whosoever is coming in the highly exposed group, as well as suffering with the diabetes and other immunocompromising illnesses. Adult immunization scheduled by the medical indications. Again here we can see that, Again here we can see the pregnancy, immunocompromising conditions, HIV, men who have sex with men, means homosexuals, people those who are suffering with kidneys failure, end-stage kidney disease, heart disease, chronic lung disease, alcoholics, asplenia, chronic liver disease and diabetes. They all should be vaccinated for the influenza. They all should be vaccinated for the pneumococcus, and they all should be vaccinated for the hepatitis B 3 doses. So ultimately, as summarizing the talk, diabetes mellitus is often identified as an independent risk factor for developing infections. Diabetics are at high risk for complications, hospitalization and death from pneumococcal disease. Pneumococcal immunization in diabetic individuals significantly reduces morbidity and mortality related to pneumococcal disease. Diabetics have a normal response to vaccination, so vaccination could be a good choice to avoid infections in the diabetics. Normally it is not seen in the immunocompromised illness, but in diabetics you can get a good response of the vaccination. Vaccination is a cost-effective preventive strategy, especially in the diabetic individual, so it should always be followed. Indian guidelines for adult immunization released by the IAP, Indian Academy of Pediatrics, API, Association of Physicians of India, ACIP, Canada, Australia and ADA recommend use of the polysaccharide pneumococcal vaccine for individuals those who are suffering with diabetes mellitus. Thank you very much. And again, I invite you for the RSSDI 2015 at the end. Thank you.
Any questions or comments?
Should be given?
Should be given only up to 59 years in non-diabetics, hepatitis B.
Hepatitis B to
Why
every
59
person.
years and not beyond?
Yeah,
Why?
it has been recommended to give every person who is high risk exposed to the diabetes, like having the professional hazards like the medical personnel, those who are interacting with the blood, as well as those who are having the low immunity, like they are suffering with the immunocompromising disease like diabetes. They all should be given the hepatitis B immunization at all age. But for the normal population, it is recommended to be given above 65 years, because they think that if the person is not having high risk for the hepatitis B, then it may not be requiring for that. These are the recommendations, and these recommendations can be varied depending upon the prevalence of the disease, depending upon the risk of getting the disease in different countries. And many a times recommendations are also governed by the resources. We cannot say that every Indian should be vaccinated for the hepatitis B, because again it requires a lot of resources to provide the vaccination to every Indian against the hepatitis B. Yes. What is the difference between these two? Yeah, both can be given. They basically, this core antigen containing PCV vaccine is a pediatric variant of the polysaccharide pneumococcal vaccine, which is usually given in the adult age group, and it requires certain time to be effective. While the core antigen is effective immediately, but it does not have a long lasting life. So it should be, even if you have given the PCV to, especially in the adult, or especially in the elderly people, then you have to give after the 12 months that this polysaccharide pneumococcal vaccine, so that the immunity should remain for a longer time.
Yeah. Can I have? What is the
One
incidence?
one question. Yes.
What is the incidence of pneumococcal infection in diabetics, and how frequently do you have to repeat the vaccination after giving the initial
What are the incidences of pneumococcal
disease in diabetics?
Pneumococcal disease in diabetic individuals? Of course, we do not have Indian data regarding this, but what the American data is available, I have shown you in the slides that about 43% pneumonia cases in the United States have been found to be suffering with the pneumococcal disease. 43%, and out of this 40% were the culture positive, and remaining were having the culture positive for the either for the Haemophilus influenzae or for any other organism. So as far as the Indian data is concerned, there has been only one multicentric study which I have discussed in my one of the slides, which has been done in few of the medical college across the India, including AIMS, KGMC and Vellore. But this study does not reflect the situation of the whole country. This is the one study for which we really need the meta-analysis of multiple studies. Then we can actually come to know what percentage of the diabetic individuals are suffering with the pneumococcal disease. Because we have just got to know what percentage of the diabetics are there in our country few years back. So it really takes time to go into the sub-segments of the diabetes, how many are suffering with the pneumococcal, how many are suffering with the other diseases.
When do you have to repeat the vaccination?
Pardon?
When do you have to repeat the vaccination?
Yes, repeat in diabetic individuals, uncomplicated diabetes, the one vaccination is enough for the lifetime. So it is not required to be repeated.
So we come to the
Pardon? if the vaccination is given in
Month of November.
in month of November, then
That's what they recommend.
it,
Influenza vaccine.
it should be
Even in the month of November.
yes.
This is a recommendation.
These recommendations are
Yeah. Even in the month of November.
in the month of November. I really do not know about that. Thanks for the increasing my. But what is the good reason of giving this in the month of November? But that climatic conditions is variable for different parts of the country. Yeah, you can say that.
So with that, we come to the end of the session, and I thank Dr. Anuj for this brilliant talk. Thank you.